Basically, this book was designed for patients. When you come in, we talk in a consultation. It's not always easy to remember everything we say. Everyone's sort of on a different level. Some people are sophisticated when it comes to cosmetic procedures. Some people are first-timers. So when you go home, I want you to feel like you have a resource you can look at and say, well, what are some frequent questions that someone else might ask, and what are the answers to those questions? So the book is broken down into 8 subheadings, and each of those is a specific concern that someone might have based on their cosmetic appearance, and there's a chapter also on veins. So I'm going to talk about 3 of those issues tonight. And the top 3 cosmetic concerns that I see from day to day, number 1 would be wrinkles, number 2 would be excess fat, and number 3 would be looking tired. So those are the 3 things that people come to me and say, you know, this is what I really hate. So we'll go through each of those, but they're also in the book, and the book goes through more detail. I'm just going to briefly touch on some of those points. So from day to day, we go through our lives and we have our daily activities, and generally we feel pretty good, but we don't always show people that we feel good based on our appearance. And so I think really the main goal of any cosmetic procedure is to help someone portray the feelings that they have about themselves inside and the outside. We just want to look as young as we feel. And sometimes our appearance betrays our internal emotions and feelings and our youthfulness. I like this quote, there's really no absolute standard of beauty, and that precisely is what makes its pursuit so interesting. Now, we do know that some people go overboard, right? And raise your hand if you think that this is an example of someone going overboard. Right? I think sometimes some people have too much money, and so they do too many procedures, or they don't know where to stop. So people ask, what's the most important product that I should be on? And it's sunscreen. That's the number 1 cosmetic product. Those are the 2 main products. They're very similar, and people ask a lot, what are the differences between the 2? They're essentially the same molecule. It's botulinum toxin type A, and it helps relax muscles. Really works great between the brow, these frown lines that we get, we call them the 11s, or for smile lines, or crow's feet. And it works for about 4 months. Really the best thing for those frown lines. And here's an example of one of my patients. She had Botox here between her brows, and also for smile lines. It helped elevate the brows a little bit, so you can see she got a lift without surgery, and it smoothed out a lot. It will work even better. The next thing is fillers, and people also ask me very frequently, what's the difference between Botox and fillers? Botox helps relax the muscles and really works great around the eyes. Fillers are more for creating volume, and you can inject fillers underneath creases like we call them the nasolabial creases alongside the nose or in the cheeks to create volume. So fillers lift where Botox relaxes muscle. So the type of, here's sort of a diagram of what a wrinkle would look like in the skin. It's actually a fold or a crease inside the skin. And we put the fillers underneath those folds to help lift them. So it's made out of a gel that's constituted by a type of a sugar that we naturally have in our body. So we break it down over time. Those are the most common fillers. We call them hyaluronic acid fillers. But things like Restylane or Juvederm or Perlane, those are the safest fillers in my opinion. They last you usually between 4 months to a year. And here's an example of somebody who had fillers in her cheeks and along those lines around the side of her nose. And you can see the little dots where this was right after her treatment. So you see the filler results immediately. And she's someone who'd lost some weight over a period of years. And so by replacing that volume, it makes you look more youthful, more relaxed. The next step after the fillers and Botox would be laser resurfacing. So what does laser resurfacing do? We're actually doing a controlled burn on the surface of the skin. We're taking away some of the old skin cells, and we're allowing some new skin cells to replace them. So laser resurfacing works. The newest laser resurfacing products, they're called fractional lasers. And the way they work is they will treat a fraction of your normal skin and leave some skin behind. So when you heal, you have some normal skin cells that are still floating around there, and they'll take over and grow, and you have less downtime with the old lasers. The old lasers, you're kind of in bed for 3 weeks, looking like you're a burn patient. Now it's really about 5 or 6 days that you have downtime. After that, you're still red for a few weeks, but it's normally like a pinkish kind of red that you can cover with makeup. But it's a lot safer and a lot less downtime than it used to be. So everyone has a question about extra fat, almost everyone. And sometimes it's just perceived extra fat. There may not be extra fat. But it's funny, I think that even people who are super skinny think that they're too fat. It's something that I think we're conditioned to think. And there's some new exciting things that will help remove fat without surgery. That's actually the hottest topic right now in the office. There was the laser resurfacing. This was a patient we were talking about laser resurfacing. And so she had a lot of loose, kind of crepey, thin skin. And after a laser, you can see it really smoothed her out, and it really took off about 5 to 10 years. So let's go into fat. Now, when we're talking about procedures that address fat, we're not talking about weight. We're talking about that pinchable fat and shaping some areas that always seem to be stubborn. They don't go away as you lose weight. But it's not designed for weight loss when we're talking about things like liposuction or non-surgical fat reduction. Now, there's a difference between men and women, right? A lot of differences. But when it comes to fat, men are apples and women are pears. Men tend to collect fat along their waist, and women it's more towards their hips, a little bit lower. And when you see a man at the beach and it looks like he's carrying a beach ball around, like it's just that, and if you pinch his belly, you can't really pinch much, that's usually visceral fat, and it's the fat that's inside, underneath the muscle, and it puts you at risk for heart disease. And that fat, you can't really do anything in terms of cosmetic procedures. You can't address the fat that's on the inside. You can really just treat the stuff that you can pinch. So if someone comes in and they have a lot of visceral fat, say this is a weight loss issue. When it comes to the fat that you can grab, then there's things that you can do. This is the newest procedure that's around, and it's the best thing that works for fat reduction. It's not surgery. People come in every day, this whole week. I think it was on Dr. Oz and it was on the doctors. And so everyone was curious about it. And I'm a skeptic when it comes to cosmetic procedures, the newest laser, but it actually works. So what are we doing? We put a pad on the skin. There's a suction on the front of the pad, and it creates a seal. So it pulls your skin into this little suction device, almost like a vacuum cleaner. And then it starts freezing the skin and the fat. These very smart guys at Harvard figured out a temperature that you can keep the fat at a temperature that actually starts to injure the fat cells, but your skin cells are not injured at all. Okay, so as the fat cells are frozen, okay, they start to, they actually die, and they don't come back. So you won't get those fat cells again. And then the remaining fat sort of condenses, so the area is smaller. And we're seeing patients that get about 1 centimeter of reduction in terms of their fat thickness every time they do the treatment. So some people just need one treatment. Other people can do it 2 or 3 times. But it really works, and it's not surgical. There's no cutting, and it's really not painful. There's some numbness during the procedure because you're cold. And it's incredible the way they figured this out. There was this study from about 20 years ago where they saw that children that were sucking on popsicles all the time, the flavored popsicles, they would have thin cheeks. Actually, the cold was killing the fat in their cheeks. In children, you can grow new fat cells, so it would come back. But in adults, you don't grow new fat cells. So based on that observation, they were able to figure out that you can treat extra fat pockets. This was one of our first patients. This was with one treatment. So she lost that little pouch in the bottom of her belly, and it takes an hour to do each area. She had 2 areas done, her upper and lower belly. Now in between her before and her after, she lost about 4 pounds. So she was dieting and exercising, and it kind of motivates you. But the 4 pounds still wouldn't account for the big change that you see in that area. So it really does help shape you. Now, if you want to see a more dramatic reduction at one time, then we do something a little bit more aggressive. It's laser liposuction. It's safer than the old liposuction, because when we use the laser, we can melt the fat before we suck it out. So we use smaller tubes, but essentially the area is numbed up with an anesthetic fluid, and we use little tiny holes. They're about 1 millimeter in size, and we can suck out fat from an area. That's usually a one-time treatment for each area. And you're looking at about a week of downtime in terms of soreness, although if it's a small area, you might only have a day of downtime. So here's a cartoon showing the laser is melting some of the fat cells underneath the skin. Now, with liposuction procedure, Homer's not going to get to be like the way he looks in the mirror with one treatment. In fact, he may never get to that point. So a liposuction procedure doesn't change your lifestyle, doesn't change your exercise habits. It's for shaping certain areas. This would be an unrealistic patient. You can't go back to eating donuts after you do it and then expect that you'll stay the same. And here's one of my patients. She had laser liposuction of her inner thigh. So this little pouch right in here. And this was a week later. She didn't really have much downtime or bruising or swelling. We also did her lower belly into those little tiny holes. So at a week, you see a little red dot. And they close up. Over time, they're almost invisible. This is another patient. Now, she worked on losing weight while she was doing it, but her belly was always a problem area. And she had some loose skin. She actually had the stretch marks on the bottom. But with the liposuction, using the laser, we were able to get some nice tightening and flattening at the same time. So she fits into her clothes a little better. In fact, she went down a size. And even for the small areas right underneath your chin, using the laser liposuction, you can improve your contour when you look at your profile. She looks lighter, even though she didn't really lose weight, but she looks thinner. And usually people do lose weight afterwards because they feel better about themselves. So that's the excess fat. And we're going to go to the third one, looking tired. What is it that makes us look tired? Usually it has to do with our eyes. And that's what people are looking at. When they're talking to you, they're looking at your eyes. They're not looking at your neck or your ears. Unless something is totally out of normal, people are usually looking at your eyes. And that gives away really tiredness, even though it may not be true. But the eyelid skin is the thinnest skin in our bodies, and it stretches out more quickly than any other skin. So we see aging changes there faster. Now, he was certainly under a lot of stress during his presidency, but I'd say his face in general looks relatively young, other than the area around his eyes. Now, he doesn't need to do anything surgically because he probably doesn't care. He may be happy with where he is, and a lot of us don't mind. And I don't think anyone ever really has to do anything, but we do procedures or surgical procedures because we want to feel better about something. And you do it for yourself. You don't do it for other people. Hopefully the people around you will support you. For her, she was concerned about the bags under her eyes and the shadowing. She said, I'm not really ready for surgery. So we did a filler. We talked about the fillers before. They create volume. And we injected some filler in this shadow underneath her eye. Okay, so we didn't do anything with her fat. And here she was a week later. She had a little bit of a bruise on one side. You can see. And she can cover that up with makeup, but she didn't wear the makeup there because we wanted to take a picture. But it made her look more relaxed. She still has some of her normal contours and her lines, but she looks like a slightly more refreshed and less tired version of who she normally is. And even in young people, they have bulging fat. This she probably got from her parents. And she said, I hate these shadows that I always have. This was a surgery. So we went from behind her eyelid, so there's no scar on the front, and we reduced these little fat pads right here. And by doing that, she has less shadow, and she feels like she portrays her true emotions. She's not a tired person. Now, we were showing the picture before where this upper eyelid skin stretches very easily. It gets very thin. So in her, this was an insurance problem. It was a functional issue. When she's driving and she's looking to the side, her eyelid skin is obstructing her vision. So her insurance actually covered this procedure by removing a thin strip of skin from the upper lid, the incisions hidden inside of this crease, and now she can actually see more, and she looks better at the same time. The same thing happens with men. And we were looking before at a picture of Kenny Rogers. I think the problem there is that there was too much done. Too much eyelid skin was taken out. His brows were lifted too high. We want a man to have sort of a heavy brow. You don't really want to see too much eyelid on a man, especially if you didn't have it before. So by just removing the right amount of skin, he looks natural, but younger. So I think sort of overall, feeling tired has to do with, or looking tired has to do with what our eyes are showing off to the world. So sort of summarize, first of all, I want you to enjoy the book. I'll sign copies and we'll give them out afterwards. I want you to kind of mingle around. You can talk to myself or Dr. Moak if you have questions about any procedures that we do here, varicose veins, or the new cool sculpting procedure, or fillers or Botox, things like that. I think wherever you go, if you do a cosmetic procedure, you want to feel like you have a good rapport with the person that you're meeting with. You want to feel like your questions are being answered and that you're on the same page. You want someone who's going to listen to what your concerns are, maybe even bring in a picture and you see how you looked a couple years ago. And really, I think the goal is to look the way that you feel inside. You want to look like you're not tired. And also, when you take the book home, look through it. If you enjoy the book, then you can go onto Amazon. They have the books there. You also have a Kindle version. And please give a review and talk about what you think. If you like the book, if you think that there's good pictures in there, if there's something that you would like for a future book, because we'll make new editions. In fact, the cool sculpting didn't even make it into this book because it's so new. So the 2011 or 2012 version will have that. And if any of you use the Kindle at home or you do electronic reading on your iPad, give us your email at the front. Tell us that you want us to send you the Kindle version. I'll just send it to your email, and so you can read it electronically.